Introduction. Calcium and iron are essential minerals that play crucial roles in the body's overall health and functioning. Calcium is primarily known for its role in maintaining strong bones and teeth, while iron is vital for oxygen transport in the blood and overall energy production. Both minerals can be obtained through dietary sources such as dairy products, leafy greens, nuts, and meats. However, some individuals may require supplementation to meet their daily needs, especially in cases of deficiency or specific health conditions. Mechanism of interaction. The interaction between calcium supplements and iron supplements revolves around their absorption in the gastrointestinal tract. Both minerals compete for absorption in the intestines, and their uptake can be influenced by several factors, including the form of the supplements, timing of consumption, and individual health status. Competitive absorption. Calcium and iron can compete for absorption when taken together. Calcium is absorbed primarily in the duodenum, the first part of the small intestine, whereas iron absorption occurs throughout the small intestine. When calcium and iron supplements are consumed simultaneously, the presence of calcium can inhibit the absorption of iron. Effect of formulation. The form in which supplements are taken can affect their absorption rates. For example, calcium carbonate, a common form of calcium supplement, requires stomach acid for dissolution and absorption. In contrast, calcium citrate is absorbed more efficiently in the presence of or without food. Iron supplements also vary in their formulations, with ferrous sulfate being one of the most commonly prescribed due to its bioavailability. Timing considerations to minimize the interaction between calcium and iron supplements. Healthcare providers often recommend taking them at different times of the day. Separating their intake by several hours allows for better absorption of each mineral without interference. Health risks and considerations. The interaction between calcium and iron supplements can have several health implications, particularly for individuals with specific nutritional needs or health conditions. Iron deficiency. For individuals at risk of iron deficiency, such as pregnant women or those with heavy menstrual bleeding, the reduced absorption of iron due to concurrent calcium supplementation can hinder efforts to maintain adequate iron levels. This may necessitate adjustments in supplementation schedules or the use of alternative forms of iron that are less affected by calcium. Osteoporosis and bone health. Calcium supplementation is commonly prescribed to prevent or treat osteoporosis and maintain bone density. However, excessive calcium intake without adequate iron absorption can impact overall mineral balance and bone health. Maintaining a balanced approach to supplementation, guided by healthcare professionals, is crucial for optimal bone health outcomes. Individual variability. The impact of calcium-iron interactions can vary among individuals based on factors such as age, health status, and dietary habits. Older adults, for example, may have reduced stomach acid production, affecting the absorption of both minerals. Regular monitoring and adjustments in supplementation are essential to meet individual nutritional needs. Cultural and dietary implications. Dietary habits and cultural practices often influence the intake of calcium and iron-rich foods. In cultures where dairy consumption is high, calcium supplementation may be less necessary but still relevant for specific health conditions. Conversely, diets that are predominantly plant-based may require careful planning to ensure adequate intake of both minerals through food sources and supplements as needed. Case studies and statistics. Research and clinical studies provide insights into the impact of calcium-iron interactions on health outcomes. Studies have shown that concurrent supplementation with calcium and iron can reduce the absorption of iron by as much as 50%, particularly when taken together without regard to timing. This underscores the importance of individualized supplementation plans tailored to nutritional needs and health conditions. Regulatory and expert opinions. Health authorities and experts recommend a balanced approach to calcium and iron supplementation to optimize health benefits and minimize potential interactions. The National Institutes of Health, NIH, and healthcare professionals advise individuals to consult with their healthcare providers before starting any new supplements, especially if multiple supplements are involved. Experts also emphasize the importance of monitoring nutrient levels through regular blood tests to assess adequacy and adjust supplementation as needed. This proactive approach helps prevent deficiencies and mitigate risks associated with excessive or imbalanced intake of minerals. Preventive measures to mitigate the risks associated with calcium-iron interactions. Individuals can take proactive measures. Consult healthcare providers. Seek guidance from healthcare providers or registered dietitians before starting calcium or iron supplementation. They can provide personalized recommendations based on individual health needs and potential interactions with other medications or supplements. Timing of supplements. Take calcium and iron supplements at different times of the day to minimize competition for absorption. For example, take calcium supplements with meals and iron supplements between meals, or with vitamin C-rich foods to enhance iron absorption. Monitor nutrient levels. Regularly monitor blood levels of calcium, iron, and other essential nutrients through laboratory tests. This allows healthcare providers to adjust supplementation and dietary recommendations accordingly to maintain optimal health. Conclusion. In conclusion, while calcium and iron supplements are valuable for meeting nutritional needs, their simultaneous use can affect absorption and potentially compromise health outcomes. Understanding the mechanisms of interaction and adopting preventive measures, such as timing supplements appropriately and seeking professional guidance, can help individuals achieve optimal nutritional balance and support overall health. By integrating these strategies into daily routines, individuals can navigate supplementation effectively and promote well-being through informed dietary choices.